Hi, I'm Dr. Alec Correa, consultant medical geneticist at Apollo Proton Cancer Center, and today I will be talking to you about hereditary cancer syndromes. A common concern among patients with cancer is whether their children will be at risk of developing cancer, or an individual with a family history of cancer is often worried whether he or she will develop a cancer in the future. In order to answer those questions, it becomes important to know about hereditary cancer syndromes. 5 to 10% of all cancers are hereditary. That is, they are caused due to mutations in our DNA, which predisposes an individual to a high risk of developing cancers throughout their lifetime. So who requires genetic testing for cancers? When an individual comes to us, we assess them and see whether they require genetic testing. Common red flags are developing cancer at a young age, or multiple family members with cancer, or if they have certain types of cancer which are known to have a high genetic predisposition. If an individual fits the criteria for genetic testing, we test them to see whether they carry a mutation in any of the hereditary cancer genes. So the next question is, what is the benefit of genetic testing? The first is that it helps us guide treatment. Certain genetic mutations have targeted treatments which can help improve their outcomes. Second, we can counsel them about their future cancer risk, since they are at a high risk of developing cancers in the future, and we can initiate risk reduction measures and screen for these cancers. Thirdly, we can test other family members who are at risk to know whether they also carry the same genetic mutation, and in case they do, we can initiate the risk reduction measures and cancer screening in them. The aim would be to prevent the development of cancer or pick it up at an early stage so that treatment outcomes can be optimal. So if you or any of your family members have cancer, please speak to a clinical geneticist to understand whether you are at risk for a hereditary cancer syndrome. In case you are at risk, get the genetic testing done, and if positive, initiate the risk reduction measures and cancer screening so that you can have the best health outcomes.